The following is a clip from a speech Ellen Weber Libby, Ph.D., gave on April 26, 2010 to the Mid-Atlantic Group Therapy Association at Johns Hopkins University, Montgomery County campus, Rockville, Maryland.
I'm going to spend a little bit of time now just talking about some of the principles of favoritism and some of the key pieces that go into the theory. The first thing that I want to point out is that in the subtitle of the book, it says, How a Favorite Impacts Every Family Member. Because favoritism really is a family system. It's not something that we can look at in an isolated way, because everyone in the family is affected by favoritism. Every child in a family can absolutely be loved, and certainly as mental health practitioners, it's something that on some level we all have committed and devoted our lives to. What happens when a child isn't loved? We see devastating stories in our practices all the time. So ideally, what we're really interested in is parents, is that we love all of our kids. And so many people will say, I love all my kids just the same. Well, I can get that. Ideally, we probably would go to bat for all of our children. Someone looks at either of my children with a cross eye, and I want to belt them. How dare you hurt my child's feeling, or not accept them, or not treat them well. That's different, though, than favoritism. Favoritism is a sense of being selected for special treatment. And I want to remind everybody that no two people are alike. No, even twins are not alike. Even identical twins are not alike. No two parents are alike, and probably more honestly, no parent is the same throughout the day. We're different when we get up in the morning, when we come home from work, when we fight rush hour traffic to get home, or at the end of a day. So, of course, the relationship is going to be different in all of these constellations. That a child who I love dearly has a personality that's unique and is all their own. And based upon my mood or my frame of mind, I'm going to react to them differently. And so everything is fluid and everything changes. So while love is more constant, favoritism is more fluid. One way that I think about the distinction is I think about my earlier studies in attachment theory. And we all know about the mother and child that are too attached. Well, similarly, when we talk about favoritism, on some level, what we're really talking about is an attachment that really is not in anybody's best interest, that being in the extreme form. We all have favorites. And the question is, can we acknowledge that? Can we know that? Can we accept it? Can we work with it? Can we be open to our colleagues, to our supervisors, to our co-therapists who want to say to us, you know, you might want to step back. There's a way that you're interacting with this patient that feels off to me just a little. Do we find ourselves doing something with a patient that we don't ordinarily do, that the patient seduces us into a kind of grandiosity that makes us feel that we are very, very important? The dynamics of how favoritism play out within our groups are subtle, and they're there all the time.
For more information about Ellen Weber Libby, please visit her website at www.ellenweberlibby.com.